Launch of the 5 years National Strategic Plan for the Prevention and Control of NCDs in Rwanda. Here present are a number of government entities, the Senate, the Parliament, different ministries, other government entities, international organization, the civil society organization, the private sector, and different UN agencies. This list speaks by itself on the approach that the implementation plan will take, which will be a multi-sectoral collaboration of different entities to achieve what the government has set in its strategic plan in terms of preventing and controlling NCDs in Rwanda. It's on this note that I would like to welcome the Director General of RBC, Dr. Sabin Sanzimana, for his official welcoming remark and to allow us to have an official start. DG, you're welcome.
Good morning, Madam Tse. Bonjour. Honorable Minister of Health, WHO country representative, permanent secretaries, heads of partner organizations, dear colleagues, partners, friends, researchers, media community. On behalf of RBC, I would like to welcome you to this important event as we launch the national strategy to combat non-communicable diseases for the next 5 years. As you can imagine, this work has been taking time, with a lot of brains behind it, a lot of support to make it happen. So now is the D-Day, is the launch day, and we are very pleased to have the leaders and all distinguished partners, friends, and actors, civil society, that we are all committed to defeat NCDs for the future generation. My role is very simple. It's just to welcome you, but allow me to just mention a few statistics that are coming in my mind always when I think about NCDs. Number one is that currently 70% of deaths that are being recorded every year in the world are due to non-communicable diseases. Unfortunately, again, 85% of those people dying of NCDs are in low and middle income countries, mostly in sub-Saharan Africa. And the main killers of these people are cardiovascular diseases and cancer that are mostly preventable and treatable if they are diagnosed early. In Rwanda, the few statistics we have, and thanks to the team that NCD division and our distinguished partners working on ground, we also have an increasing trend of NCDs taking over infectious diseases, not only for those who are being diagnosed positive for these diseases, but also those who are dying from these diseases. Hypertension, the data we have, 15% from the STEP survey, 3% for diabetic, and cancer. I was discussing with Dr. Francois that approximately every year there are 5,000 cancer cases that are recorded every year in Rwanda. And mainly, the top 5 are breast cancer, cervical cancer, prostate cancer, stomach, and liver. Those are the top 5 main cancers in Rwanda that we are dealing with. The other problem is obesity. And obesity is another risk factor that we are facing, especially in big cities, in major cities. And unfortunately, obesity is not only among adults, it's also among children. So it's another challenge. I'm just highlighting a few, but there are many NCD-related risk factors and problems that we are facing through this next 5 years of strategy. So what are we going to do in the next 5 years? Many people don't read the big document, but let me summarize in just few, maybe 3 or 4 points. We have to reduce the premature mortality by 25% in the next 5 years. Premature mortality, I've been told by definition, that is when you die before 70 for diseases that are preventable or treatable. One thing we have to do is community awareness and early detection of these diseases. Number 2, we need to get data and research around these diseases and know the disease so you know how to deal with that, which magnitude, where, to whom, how. So if you don't have data, generally it's working in the dark. Understand that we are starting next, the research team at RBC and our partners supporting us, the Ministry of Health leadership. We are starting the next step survey next month. That's a good news because that will tell us where we are as we move on to the next 5 years. My last, probably most important, I see the PS mini sports in the room. We need to be active. We need to really prevent those diseases by taking care of ourselves and teaching our neighbors that most of these diseases are coming because we are sitting too long, we are eating too much, or mostly we are not eating what we should be eating, or we are overworking our body, because now with technology, people are working several hours, sometimes on phones and screens, and you don't take time to go in the stadium and run a little bit, do some push-ups and work out and enjoy life, your brains, those diseases that we prevent by just taking care of ourselves. Let me finish this few welcome notes by thanking everyone who has been helping in this journey of developing this document. First, from the Minister of Health. The Minister himself has been very supportive, even at the technical level, but also pushing to make this document finalized quickly. The WHO, of course, as you talk about health, they are always present and supporting at all levels. Thank you so much. I have a long list of partners, but for the sake of time, I want just to say thank you to all who are present in the room and those who will be speaking here and those who are following online. We welcome you to this event, and thank you, and let's move now into action, because the document is just commitment, but what will follow is more important. Murakoze cyane. Thank you so much. Merci beaucoup.
Thank you so much, Teje. And I think this gives us an image of, where we're going as a country and the numbers that we will be working with the thank you note and the welcome note. It's also important for us to understand the situation analysis of where the country is standing based on the 2020 situation analysis that was conducted by RBC in collaboration with Professor Joseph Muchumbitsi. As he goes on to the podium, I'd like to mention that he's the chief consultant pediatrician cardiologist at King Faisal Hospital, and he's the associate professor of pediatrics at the University of Rwanda. Professor Muchumbitsi graduated from the National University of Rwanda where he obtained his MMED in pediatrics and continued his fellowship in pediatric cardiology at the University of Louvain in Belgium. Professor Muchumbitsi, you're welcome.
Thank you very much. First of all, let me thank the Honorable Minister and the organizers for giving me this opportunity to present the results of this survey we did about universal health coverage for non-communicable diseases, a situational analysis in Rwanda in 2021. It was published in 2021. The background of the study, you know it, and Dr. Sabin has mentioned how high is the burden of NCDs, including in Rwanda. And he mentioned the main, we call them the big four NCDs: cardiovascular diseases, cancers, diabetics, and chronic respiratory disease, not to forget mental and neurologic disorders, which we sometimes forget to mention. The interest for NCDs started really at the global level in 2011, where the head of states from around the world convened global burden and treat of NCDs. And they emphasized the primary role and responsibility of governments for NCD prevention and control. Yes, NCD causes a large and growing burden of death and disabilities in sub-Saharan Africa, and it is projected, as Dr. Sabin said, that they will overtake the infectious diseases by 2030 if we don't do what is needed to reverse the trend. This study had the general objective to have an overview of the policy, environment, and political landscape in Rwanda in relation to the universal health coverage for NCDs. The specific objective went from not only have an inventory of the existing policies and actions that address NCDs in Rwanda, but also we try to identify the national achievement, challenges, and opportunities within the policy environment in relation to the UHC for NCDs. We try to identify key stakeholders which are involved in planning and implementing NCD programs at all healthcare level, system level. We try to identify the role and responsibilities and the involvement of key stakeholders, including people living with NCDs, in shaping the national NCD policies and program. The category of people we try to approach went from not only policymakers and implementers, but also including international organizations like WHO, people living with NCDs, academia, civil society organizations, and even private sector. The approach used for the study was a participatory approach, engaging key NCD stakeholders to collect the necessary information and draw conclusions in order to suggest recommendations for better practices, policies, and decision-making. The pyramid you see here show how the decentralization, and that's one of the first, to illustrate the first finding. The first key finding was around the Rwanda decentralization health system from the central level to the village. And we have noticed commendable achievement in addressing NCDs along that decentralization, which is still ongoing, and which is coupled with the creation of NCD clinic at district hospital level and the shifting of NCD-related tasks from doctors to nurses, which have played a role in bringing health services closer to the population, and are expected to improve the prevention and early detection and management of NCDs. The community-based health insurance is the central mechanism of the universal health coverage system in our country, which covers 91% of the population and 90% of health services cost at all levels. After its implementation, we have seen health services increasing from 30% in 2003 to 85% in 2008, and screening for NCDs is even covered in the scheme offered by the community-based insurance for men and women. And as I said, this is the backbone of our system towards the universal health coverage achievement in Rwanda. The other findings showed that through the health sector performance report, indicating that a lot of efforts have been invested with a focus on that decentralization I was talking about, and that includes not only the NCD clinics in different district hospitals, but it has been brought down even in 5 districts to health centers where training has been done and NCD services established, as well as mentorship program continue to be conducted to improve the quality of services offered to patients at the community level. In this study report, a total of 91 participants were interviewed, of whom 94.5% were very well aware of NCD's negative impact on the national economy, and 90% of them recognized well the interdependence between NCDs and their risk factors. Among the respondents, 80% were aware that they are addressing NCDs in what they do in their different roles, while only 50% of the respondents said they were involved in the planning of NCD programs, and 69% did not participate in the implementation. The involvement level of stakeholders in planning NCD program was found to be quite fair at 50%, but the participation or involvement in the implementation was low, down to 30%. These may be related to inadequate multisectoral coordination mechanism or insufficient monitoring and evaluation systems, or low level of program ownership, prioritization, or NCD awareness at different levels. You will see the details in the report, which is available, but for the sake of time, I would like to say that all our findings have shown that the policy environment and the political landscape in Rwanda are favorable for strengthening the health system in relation to the universal health coverage for NCDs. Nevertheless, there are some gaps that have been identified, and we have tried to present the following suggestions for better practices, policy, and decision-making in the area of universal health coverage for NCDs. The first one, the main one, is about the need for a high-level multi-sectoral coordination mechanism, which, because as we have said, all policies and strategic structured plans, guiding policies, and clear list of stakeholders with the specific roles and responsibilities in NCD's prevention and program are in place through the Ministry of Health and through the government. But we know also that the high-level multi-sectoral coordination committee, ideally at the level of the Prime Minister office, has been recommended not only by the World Health Assembly, but also by WHO, in order to oversee the implementation, the performance and effectiveness of all NCD policies, plans, and programs, as well as the accountability of all stakeholders. That's why we would like to recommend that there should be a multi-sectoral coordination committee for NCDs, which would be assisted by the existing National NCD Technical Working Group, which has been assisting the Ministry of Health, the Rwanda Biomedical Center, for many years in elaborating the different programs, and which needs to be not only reinforced, but also formally created. These would progressively improve the enforcement of the laws and policies, the follow-up reporting, research, and monitoring and evaluation of the programs for evidence-based interventions and planning for universal health coverage and then for NCDs. The other key recommendations is about the financing of universal health coverage for NCDs. Within the competitive priorities, budget allocation for NCDs is still a challenge, as large amounts of the national budget are still relying on outside partners' contribution. There is a need to explore alternative financing mechanisms like increased excise tax on the risk factor commodities like alcohol, tobacco, sweetened drinks, and others, and to earmark part of the generated income for NCDs prevention and control programs. We know that it has been shown to work very well in other countries. Moreover, it is time to think about engaging platforms that may attract more investment in NCDs, which could help to cut back the cost of inaction on NCDs. The third recommendation is about strengthening awareness and education in the community. Knowledge is power, but the current mechanism and budget allocation for education and awareness about NCDs are still not effective enough. NCDs need to be addressed from the grassroots level through the community health workers' education, through involvement of civil society organizations and people living with NCDs who can play a role in reaching and educating the community if they are empowered and facilitated enough to collaborate with local leadership for NCD prevention and control. Thank you very much.
Thank you very much, Professor Muchumbitsi, for the so very well elaborated survey results and recommendations. Next, I think we're going to hear from Dr. Francois Uwinkindi on how the strategy was elaborated and the costed action plan, which will help us address some of the components that Professor Muchumbitsi has mentioned, the challenges of decentralization and ownership and stakeholder involvement. And this will help the country to solidify some of the key achievements that he already presented. Dr. Uwinkindi, he is the division manager of non-communicable diseases at RBC. He holds a medical degree and a master's degree in epidemiology from the University of Rwanda. He has previously served as the director of Cancer Diseases Unit for 4 years. That's from 2015 to 2019. And he occupied also a post at the National HIV Control Program with different roles and responsibilities in prevention, care, treatment, monitoring and evaluation, and clinical research. Prior to joining RBC, Dr. Uwinkindi worked as the medical officer at Byumba District Hospital for about 2 years. You're welcome.
Okay, thank you so much. Honorable Minister of Health, the country representative of WHO, permanent secretaries, Director General of Rwanda Biomedical Center, Vice Mayor, the City of Kigali in charge of social affairs, heads of different organizations here present, civil society organizations. Actually, it's a great honor to be standing here in front of you, presenting key highlights from our new 5-year strategic plan that will help us to reduce the premature mortality due to NCDs by 12% by 2025. So seeing all of you here, it's really, I'm sure that we will be able to reach our targets that we have in our NCD strategic plan. And I think my work will be easy because you have seen how NCD is a big issue worldwide, but also here in Rwanda. I mean, the burden is really, I think, we are shifting from infectious diseases to non-communicable diseases. And then to be able to fight these NCDs, we need a multi-sectorial approach. The health sector alone cannot be able to, to provide a lasting response to this big burden of NCDs. So we need everybody here just to work with, in close collaboration and make sure that really every sector is playing its role, and then you have a good collaboration mechanism. So what I can say here, it's a strategy, and I think the findings that have been presented by Professor Muchumbitsi also informed the development of our national strategic plan. As you can see, there are some of those gaps that have been highlighted, and this strategic plan is coming to address all those gaps that have been highlighted. So the vision for our national strategic plan is to have a national free from an avoidable burden of non-communicable diseases, but also including injuries and disabilities, because we can present most of these NCDs. And then implementing best buys related to NCDs prevention, we can reduce 40% this premature mortality due to NCDs. The mission of our national strategic plan is to enhance a multi-sectorial collaboration. As it has been highlighted by other speakers, we need to work with all stakeholders that we have here in the room, but also others that are not here, to alleviate the economic, social, and the medical burden of NCDs, to be able to reduce the morbidity and the mortality, and also improve the functionality and ensure to be able to ensure a healthier population. So doing all of this, we should make sure that by 2025, of course, in 5 years, we should be able to reduce the premature mortality due to NCDs by 25%. So it's an ambitious target, but having all of you just on board, for sure we should be able to achieve it. And then implementing our strategy over 5 years, we will be reaching out to 4.5 million people over these 5 years. So, and you cannot do it alone without having all of you on board for the implementation. So our strategic plan has got 4 strategic objectives. The first one is related to prevention of NCDs through health promotion and also the reduction of risk factors. The second one will be dealing with strengthening the health system for early detection and also care and treatment of NCDs. The third objective will be dealing with strengthening the disease surveillance, research, but also having a robust MN system to be able to implement, to have evidence-based interventions. The fourth objective will be focusing mainly on having intersectorial coordination, advocacy, but also mobilizing additional resources for a successful implementation of our NCD prevention and control strategy. Allow me to go a little bit deeper in what those priority areas that we think we should be focusing on over the next 5 years to be able to provide, like to make the prevention of NCDs through health promotion and the reduction of risk factors. So I think we all know these major risk factors that are fueling this NCD: tobacco smoking, unhealthy diet. We should be active. We should reduce the quantity of sugars and also the salt that we are taking. Again, acting on these major risk factors, we can be able to reduce the mortality due to NCDs by 40%. So I think these are things that we can do without even having a big investment. So it's just changing our health style and be sure that really we are now living a good life. So now to do this, awareness is key. We should make sure that really we educate our community through different strategies to make sure that they do understand these risk factors and also take decisions to change their behavior. Again, policies and regulations. These are really strong tools, strong weapons to prevent tobacco policy. You have ministerial does on tobacco. By now, we need also to tackle those other big risk factors. Working on alcohol use, working on these and health, we are, reaching to everybody, teaching, the danger of these risk factors, and also make sure that people understand and change their behaviors. So prevention is key, but alone, we know that even age is also another risk factors. So we should make sure that as we work on the prevention of NCDs through health promotion and also sensitization about risk factors, we're also strengthening our health system to be able to do early detection, but also provide a quality treatment to our patients that will have NCDs. So early detection, it's really a priority action here. And also we do early detection, but also we make a linkage to care. So screening in the community, outreaches. So not only doing screening at the health facility level, at the health centers, but also going down there at the community level to make sure that we can use all those different strategies and opportunities to reach out to these people that are in need of NCD early detection. So if you look at the data we have, so the prevalence of high blood pressure is 20%. For diabetes is 3%. So, but if you look at the people we have with this in the coverage is 15%. We still have many community that they have, and then there are those coming at their facility with a very advanced stage. So should make sure that we do awareness, but also make sure that these screening services are closer to our population. And again, we make sure that you have a good workplace screening program so that we know that people are busy with their work, sitting the whole day on their computers, and then we should make sure that we go there and be able to provide these services at their workplace. We need also to have some innovations. How can we teach our people to do self-screening, at home? And then once I find abnormal values, I can be able to their facility for further investigations. Again, working on early detection, we should also make sure that our health system is ready to provide appropriate care to this increased number of people that will be identified during the screening. So we should make sure that our facilities have enough medication, laboratory services, and also technologies that to be able to provide quality management to our patients with NCDs. Again, we know that some NCDs need advanced or specialized management. We are still sending many people outside India, Europe, and elsewhere for the management of NCD, especially cardiac surgery, renal transplantation, some specialized cancer management. Over these 5 years, we will put much efforts in availing and establishing specialized NCDs and injuries, diagnostic and treatment centers, working on infrastructure equipment, but also building the capacity of our human resources to be able to treat our people here in Rwanda and also treated by Rwandans, very trained Rwandans. Again, the management of NCDs, is really expensive. We should also make sure that we work on the financial accessibility, working with health insurances, but also having other innovative mechanisms that will help us to make sure that these services that we are putting in place are accessible to our people. So to be able to monitor, to see if we are on track or not. So we also put in place a strong NCD surveillance system, make sure we invest more in research, but also have a robust monitoring and evaluation system. So we are shifting totally from paper-based consultation at different facilities. We are now promoting, we are putting much effort in use of electronic medical record systems. We have good indicators into our MN system, HMIS, at all levels. We have now good disease registries. Here I can mention the cancer registry that is now giving us good data on NCD on cancer issues in the country. Surveillance systems for NCD risk factors, and also promote vivid research to be able to have, to inform our policies and also our plans. So these are things that we put much effort over these 5 years to make sure that we have good information on NCD burden in the country, but also be able to monitor what we are doing. Again, the fourth objective will be focusing on intersectoral coordination, advocacy, but also research, resource mobilization for prevention and control of NCDs. This has been highlighted in the research that has been presented shortly by Professor Muchumbitsi. We have now a working national technical working group, but again, we'll be putting in place a high-level national coordination committee, putting together different stakeholders that even the majority of them are here to make sure that really we work, in close collaboration to bring solutions to this big burden of NCDs. The centralization of the coordination mechanism of NCDs, but how make sure that even district sectors have got a coordination mechanism for NCD prevention and control, and then we build strong and meaningful local and also international partnerships so that we can really have enough resources for our NCDs activities. So funding is still needed. So as it has been highlighted, NCD response is still underfunded. So increasing the domestic funding for NCD response, having private and public partnerships projects will help us really to increase the funding for NCD response, and then working on grant mobilization from different institutions in order to have enough resources to implement our strategy. So, and what you have said has got a cost. So over the next 5 years, we need 359 billion Rwandan francs to be able to implement all we have said. And as you can see, the majority of, the budget will be on NCD detection, care, and treatment. So our budget is still, because we are still having many people, and the management of NCDs is really expensive. So that's why you can see that a big chunk of money will be on NCDs, detection, care, and treatment. And even these costs will be increasing over years as we be identifying additional people still in the community and to bring them into care and treatment. So, and again, as you can see that NCD prevention has also, we take 16%, and then M&E, and then for the coordination. So we used, for the costing, we used One Health tool, as it has been recommended by the World Health Organization. As you can see, so we have a gap based on the current expenditure and even projected expenditures. We still have a gap. We still have a gap to raise to be, to address to be able to have this required budget to implement our NCD strategic plan. And as you can see, the gap will be increasing over years if we don't increase exactly budget allocation to NCD's response. So, and what should be doing now? So the government, but also development partners, we need to increase the budgetary allocation for NCDs at an annual rate of 20% to be able to bridge this gap that you can see here. And again, for health insurances, we need also to expand the benefit package for NCDs. We still have some services not yet covered, and then patients are suffering a lot to be able to afford those services. Again, we are still seeing many people coming at a very advanced stage, so we need to shift from reactive treatment to proactive prevention. So, and once you initiate the treatment at early stage, you also have better treatment outcomes, and then so this is something that we should really now be focusing on, and also explore different innovative resource mobilization strategies to be able to have enough resources to implement our NCD strategic plan. So as I finish, allow me to acknowledge different partners that have supported the development of this NCD strategic plan, but also the same partners that will also be with us for the implementation of this NCD strategic plan. Honorable Minister, distinguished guests, these are the highlights for our NCD strategic plan, and you have more details in the documents, in the big NCD strategic plan document. So I thank you so much for your kind attention. Thank you.
Thank you so much, DM. And I think the audience has a clear image and understanding on where the country is going and what we are called to do on our respective, in our respective organizations or entities. With that said, and on that note, we would like to officially welcome the Honorable Minister of Health to launch, so to say, the implementation or the actualization of the National Strategic Plan. There will be a bit of protocol, and the media, please don't overcrowd the space so that the audience can also follow. Honorable Minister.
It's okay. It's okay.
Thank you, Honorable Minister. With that gesture, we welcome your keynote speech.
WHO country representative, permanent secretaries, vice mayor, City of Kigali, Director General and senior government officials from different institutions, colleagues from UN agencies and development partners, head of international NGOs, national NGOs, civil society organization, patient groups, member of the press, distinguished guests, ladies and gentlemen, good morning. On behalf of the health sector, I would like to express my pleasure to attend this National Strategy and Costed Action Plan for Prevention and Control of Non-Communicable Disease in Rwanda, 2020-2025, coinciding with the celebration of the World Heart Day 2021. At the very outset, let me thank each one of you who contributed for the drafting of this strategy, which is not only a dynamic but actionable and achievable strategy. This is a brilliant example of what we can accomplish if we work together as partners. On this note, I also commend our strategic partners for guiding us through the whole process of developing this strategy. We appreciate your support and look forward for the implementation of this strategic plan. Distinguished participants, like many other countries, Rwanda has a substantial shift in disease burden. Non-communicable disease such as cardiovascular disease, cancers, chronic respiratory disease, diabetes, mental and neurological disorders are currently the main cause of premature death, accounting for 44% of total death in the country. It's quite less compared to what it is at international level. NCDs have affected the whole spectrum of the society, irrespective age and socioeconomic status. The unfortunate part is that most of these NCDs are totally preventable, and we know what can be done to prevent a good number of NCDs. It's about lifestyle changes. Reducing alcohol consumption, stopping tobacco use, reducing excessive salt and sugar intake, eliminating industrial trans fats, regular physical exercise, strengthening awareness, because NCDs are just silent killers. Evidence have shown that early detection of NCDs are linked with better treatment outcomes. Over the next 5 years, we'll put much effort in strengthening the health system from the community to tertiary health level for NCD early diagnosis and management. The goal is to upgrade existing infrastructure, equipment, and train critical mass of health care providers. The new national strategy and its costed action plan requires multi-sectoral action and coordination for reducing NCD risks, factors, strengthening the health system, disease surveillance, and innovative action for the control of NCDs. Among these innovative action, the government is already investing in construction of a heart center, part of some specialized centers to contain NCDs. To this end, I call upon all the stakeholders to come forward and support the implementation of the National Multi-Sectoral Action Plan to combat NCDs in our country. It is only through such multi-sectoral approach that we can halt the rise of NCDs in Rwanda. Through this ambitious national target of tackling NCDs as chronic emergency, we hope to achieve the Sustainable Development Goal 3.4, which intend to reduce by 1/3 premature mortality due to NCDs by 2025. Distinguished guests, ladies and gentlemen, I want to express our gratitude to all partners who contributed to the development of this plan, and to those already committed in co-funding the implementation of this plan with Government of Rwanda budget. With these few remarks, I'm pleased to announce that the national strategy of NCDs and its costed action plan 2020-2025 is officially launched. I thank you.
Thank you. Thank you, Honorable Minister. If you allow, as you're still on the stage, I'd like to welcome the Principal of the University of Rwanda, the WHO representative, Professor Muchumbitsi, and DG RBC, to kindly join the Minister up front for a joint cut of the ribbon that was holding us from the implementation of the strategic plan, and have a picture that will show that it was officially done and accepted. Andre will help us show how the picture will be taken and how the ribbon will be cut. While that is happening, please feel free to stand up and stretch. We're speaking about NCDs. Let's work by example. All right. All right. Thank you so much. Thank you so much, Honorable Minister and the team. All right, as we transition to the panel discussion, we would like also to emphasize that we are also celebrating the World Heart Day. I've been asked to say this in Kinyarwanda, and I'll do so. bantumye ngo mvuge yuko imitima yacu tugomba kuyirinda kuko ariho iby'ubuzima bikomoka. Sinzi niba mbivuze neza mu Kinyarwanda ko babintumye. As we transition to the panel discussion, I'd like to welcome Mrs. Monique Huss, the DG of Community Development and Social Affairs at Minaloc. She's a social scientist with more than 10 years of work experience as a sector-level social affair and executive secretary. All right, thank you. She has also served as the Director of Planning and Social Affairs at the Nyarugenge District. Welcome, Mrs. Monique. Next, we would like to welcome Dr. Ndungu Selaba, the WHO representative in Rwanda. She has been in charge of WHO Afro coordination of HIV and AIDS treatment in West Central Africa. She holds a medical doctorate from the University of Abidjan and a Master's of Sciences in Public Health from the University of Tulane. She has more than 20 years of work experience in strategic planning that she has acquired through serving more than 24 African countries. Next to her, Dr. Joel Mubirigi. He is the current Executive Director of Inshuti Mubuzima Partners in Health. He's joined the organization since 2011 and has successfully led the decentralization and integration of NCD and mental health interventions in the Burera district. Mubirigi holds a general medicine and surgery, as well as a diploma of tropical medicine from the London School of Hygiene and Tropical Medicine. We would also like to welcome Regis Hitimana. He's the Deputy Director General of RSSB in charge of benefits. He holds a PhD in health economics and has extended work experience in research on health policy and health system strengthening. He has also served as a technical consultant to the WHO in developing and reviewing different national strategies for a number of African countries. Last but not least, Dr. Nima Wong Chuk. He is the country program coordinator of Defeat NCD partnership with UNITAR in Rwanda. He's a medical doctor. He has previously served as an M&E expert for Global Fund programs on HIV/AIDS, TB, and malaria for more than 3 years. He has also worked with the University of Bhutan, Ministry of Health of Bhutan, and Yale School of Public Health, as well as the WHO. Welcome to our panelists. I think we will start with the WHO. The key question was, we've heard an emphasis on the multi-sector coordination of the efforts to achieve the reduction in premature death. And the audience wanted to understand what are other strategies, or how is the WHO planning to support the government in achieving that, and what are some of the scoped resource or fundings that the WHO has already worked on to support the strategic plan, the implementation of it.
Thank you very much for this opportunity, participating in this very important session of launching the NCD National Strategic Plan. And I think this is timely for us as WHO. At the national level, at the WHO country office, we are actually developing our biennium plan for 2022-2023. And the national priorities that for prevention and control of NCDs that are aligned to the NCD NSP 2025 for the country, and also with the WHO Global Action Plan for 2013 and 2030 has been identified and integrated in the WHO office work plan that is ongoing actually. And these priorities include absolutely the integration of the NCD in the health sector, using the WHO package of essential non-communicable disease, and also developing the national rehabilitation strategic plan, as well promoting multi-sectorial approach for the implementation of the NCD-NSP. We also advocating for and raising awareness among policymakers and the general population, including also the support of national institutions to build the capacity for the prevention and management of all forms of malnutrition, the distance digital training material, the communication tool to strengthen awareness of the population and healthy diet, distance digital training as well, and implementing also the NCD survey using the STEP approach, as well as strengthening the NCD data to inform different policies. As for the support in, that we have in 2020 and 2021, WHO provided funding to develop cervical strategic plan and national guidelines, awareness campaign for hypertension, and capacity building as well of healthcare workers on cervical cancer. Actually, we will continue collaboration with partners to support the resource mobilization for the implementation of this 2025 NCD-NSP. And particularly for WHO, will be mobilizing resources for the scale-up of the cervical screening, cervical cancer screening and management of primary health care facilities, as well the development of the NCD guidelines and protocol, establishing also the coordination of the mechanism for tobacco control intervention. The other aspect also of our intervention will touch the nutrition strategic plan as well, data collection. I think it's very important to support the data collection and analysis, as well continuing the awareness for the community. Thank you very much.
Thank you so very much, Dr. Ndungu. A few questions will come after every panelist has spoken. Moving forward to Minaloc, we would like to understand what are some of the innovative approaches that Minaloc has started thinking through in terms of community awareness, community ownership, and support. It would be one thing to have beautifully written strategic plans and resources mobilized and data collected, but without community participation or support or ownership, we might be working towards failure. How is Minaloc strategizing and positioning itself to support the Ministry of Health into that area?
Thank you. It's a pleasure to be part of the panel as far as we are talking about NCDs. As local government ministry, we have decentralized entities that may help in mobilization, enhance the awareness amongst citizens. We know the NCDs is a big issue in our community. As the Minaloc, we are committed to put our effort, our energy in this project by sensitization of community to test for NCDs to mitigate the effect of disease on health. At the centralization levels, we have so-called imihigo at family level. This could also help so that the citizens could make check-up regularly to ensure their health is good. We'll put the efforts also by community awareness on NCDs prevention through sports at all levels, at SIBO, village, cell, sector, district, and good foods. Thank you.
Thank you so much, Mrs. Monique. And I think the imihigo at family level is an innovative approach that we might want to tap into to ensure a success pathway towards reducing or achieving the national strategy plans.
Yes.
Dr. Mobirigi, we've heard that your support was outstanding in the Burera district. trying to activate the NCD interventions and mental health in that district. The team would like to hear from you on some of the innovative approaches that you would advise in terms of soliciting funds and in terms of having an overall successful implementation of the National NCD Strategic Plan based on your previous experience. So it's a learning discussion that we'd like to have from you and see if we can grab a few points moving forward.
Thank you very much. A few clarification first is that our work have been covering actually 3 districts across the country, but you are right, as you said, my personal experience have been heavily involved into the direct implementation in the Burera districts. And regarding the strategic plan and costing that we just heard from Dr. Francois, for us this has come really as a dream come true in a way that we are mobilizing really a clear vision for the country around NCD. And if you looked at the numbers that was shared, we can clearly see that the heavy share of the expenses of the cost for the plan really relies on service system, health system strengthening. And I think that's a key component as we do a lot of education and really help people to change lifestyle. We still need to be able to treat and help whoever will, contract the disease. And our work have been involved in that direction mainly, and I think that's where we have been developing expertise. And non-communicable disease by their nature are quite complex, and I think they also are complex for the health system. So you're having a group of disease that are chronic by their nature, the way people live with it for a long period, but also that has a very, and I think Dr. Muchumbisi can detail that even further than me, that have a very complex, in medicine we talk about physiopathology, very complex that requires sometimes highly skilled health professional to take care of it. But in the context of Rwanda, we are dealing with a setting where you're having a high complex disease to manage with high specialized skills, but you cannot spread across the country because people are sick everywhere. So you need to develop a health system that allows a transfer of skills through the health system from the community health workers, the nurses, but also making sure that that skills that is transferred is refreshed and followed through. That's where we talk about the mentorship and enhanced program supervision. This is a key component where a lot of investment has to be put in as we make sure that the nurses, the community health workers at the community level have the skill but are applying it properly. That's one component. The other component also is on the supply of medicine. This is a disease where people, most of the patient will live on a daily basis taking a pill or taking a drug or something like that. Then you need to make sure that there's no interruption in terms of supply, stock out and things like that. So with that, what I wanted to talk when I talk about innovation is science evolve. And our commitment is to make sure that as we are getting new advance in technology, as we are getting new knowledge, either a point of care diagnosis tool that can be that can function easily at the health center and help us track or screen multiple diseases, that's something that we'll need to invest in, try and ease the process of screening for diseases. The integration of NCD within the primary health care. How do we define a comprehensive primary health care? As a mother comes in for antenatal care, how do we screen for NCDs as people are coming from vaccinations and things? How do we screen for NCDs? So that needs to be really well integrated. That may not sound as an innovation, but if you think about it, if you can integrate it in a health system, and do it well, that's a big part of an innovation in terms of, service delivery. There also when I talked about transferring knowledge or technology, this is what we call translational science. How do you, I was glad to see mentioned there artificial intelligence. How do we incorporate that advance as well into helping, facilitating patients even taking care of themselves? There's one thing that we are doing now in Eastern Province, in Wimwavu, and mainly helping patients at the community level in rural setting to use glucometers themselves, test for their glucose with automatic records, and then the record is read by the nurses when they go for a visit. Improves dramatically the care, the management of the patients. So there's a lot of innovations there, but I think to me, really the link in terms of specialized skills, how do we transfer that downward? How do we build a system that integrates care? And how do we bring in new knowledge in terms of improving that system as we move forward through this plan?
Sure. Thank you so much, Dr. Mobirigi. I think Dr. Francois and team have taken notes of the key 3 points: skills and knowledge transfer, service integration, and scoping new technology and to actualize the bigger strategy and moving forward. And thank you for sharing your experience. Dr. Regis, there was a number that was portrayed in the presentation with Dr. Francois, and I think that might have captured your attention. We are looking for more than 350 billion Rwandan francs to actualize the strategic plan. And with this, we also have read that there's a projection of a $1 invested in an NCD case is probably expected to yield a $7 return. And we are kind of pushing to our SSB a big ball to see whether if you agree with us on the return and if our SSB is ready to help us cover that amount of money in coverage. But as well, we have heard that there will be some other sources of funding. It's not coming from you alone, but how are we cascading the usage of such an amount of money? And how is now our SSB going to help the country transition from the reactive investment to more of a proactive prevention strategy? Over to you.
Thank you very much. That's a very good question. But I would like to start with some statistics. According to the document, the per capita expenditure on health in general is $37. When I was looking at the World Bank, they were talking about $58. And I'm sure if we make a poll and ask people, how much do you think of that is transitioning through our SSB? I guess people will come up with 50%, 60%, but it is only 12% if we use that World Bank figure, and 19% if we use the resource tracking number, which is $37. So in our RSSB, for CBHI particularly, we only have 19% of that per capita expenditure. And our focus is curative. It's not because we don't value the prevention and early detection, but is because we have a very huge agenda, by the way, to at least support treatment of those who have been diagnosed with NCDs. So, however, given the numbers that were mentioned, the value of investing in prevention and early detection, we didn't wait until we have a positive cash flow to say we enter into that. As Dr. Mchumbisi said, since 2016, the screening was introduced in the package, both for CPHI and drama. But our findings is that it is not used. that's true. If we're looking at the numbers of last year and for Rama, first of all, we didn't open for many health facilities, but also even those facilities that are providing, there are very few people going there. And we're trying to understand why. Of course, it sounds like we need to do more awareness and sensitization. But also, we need to look into other barriers. I had a case recently of a relative who went in one of the hospitals that is supposed to provide the services. A retired nurse who had to use half of her monthly income as just co-payment, 15% of the screening cost. So she had to pay 55,000 as co-payment for the screening. And it took her 2 days, from morning to evening. So it's not only about awareness. We also need to look into our service provision, go beyond having it on tariff, having it as provision, but see someone who is healthy, who doesn't have any complaint. Is it easy to convince him to go through that process and spend that much money to have that screening? I think that is a homework for all of us, and we need to work together to make it more accessible. We also thought, as one way to address those barriers, we have been discussing with Dr. Francois as of recent. How can we bring the services to the workplace? Dr. Francois talked about a workplace screening program. And RSSB is committed in doing that, starting with mainly our members who, I believe one of the reasons they don't go, they don't have that much time to spend to the clinic, 2 days. And probably they are not yet convinced. But the experience that RBC had going in few public institutions, when you were there, people come. So we want to expand that program, probably going further and to the private sector as well. I think that is, with limited resources we have, we are committed to doing that. Probably in the next few months or weeks, you'll hear us launching that big program. And we hope to be recurrent every year. So that's what we are working on, and we hope to continue. But also, although you didn't ask, there is also an unfinished agenda on the curative side. When you list services that CBHI has not yet started covering, most of them are NCDs. The good thing, the good thing is that the government is preoccupied by resources that come into CBHI. You have had since the last 2 years trying to find resources here and there. And the more CBHI will have resources, probably the more the services will be covering in the future. Thank you.
Thank you so much, Dr. Regis. And I think it's a good news that the unfinished agenda is being worked on. And the more we get funds, the more we'll have that part sorted out. And I think it's also important that you've had a look into the impact of the investments that has already been done. And some of the key challenges were noted in terms of service delivery and how do we make sure that communities are educated in terms of service uptake. Of course, we acknowledge and thank DFID NCD Partnership and UNITAR. They have been really invested in the development of this strategic plan and have supported this launch today. But we also wanted to understand from you, Dr. Nima, in terms of, there's need for monitoring and evaluation of this strategic plan implementation, and hence a requirement for a high-level multi-sectoral community or committee that will help us synergize and put together all these efforts. How do you practically see the role of this committee, and how will the partnership support the implementation of the launched strategic plan?
Thank you, Nadia, and thank you all the panelists for the great discussion. I'm really privileged to be actually getting the opportunity to participate and discuss on these important issues of NCDs. To respond to your question, Nadia, I think as highlighted in the earlier presentation and in the panel discussion, the prevention and control of NCDs is multidimensional and multisectoral. The Ministry of Health alone cannot do it. So the new NCD approach or new NCD response requires national engagement of all the ministries with the public sector, with private sector, with the civil society organization, with academia, or with the community. So this national multi-sector coordination team would be the driving force behind who will actually create the enabling environment, both politically as well as financially, in the successful implementation of the National Strategic Coastal Action Plan. Now, Defeat NCD partnership is currently hosted in RBC and has been supporting NCD division since the beginning of 2020. And we will continue to do so, especially in monitoring the implementation of the current strategic plan, as well as trying to mobilize resources for the strategic plan. And also, we will try to report and give feedback to all the partners and donors as well. The Defeat NCD partnership is also very grateful to the great support that we had received from His Excellency Dr. Daniel and Dr. Sabin, who were the best advocates for preparing this national strategic plan and to mobilize funds. And also we would like to thank the NCD division, Dr. Francois and his team, with whom we are working very closely. And then I think collaboratively we were able to actually mobilize like $5 million for the implementation of this current strategic plan. Together we were able to mobilize that fund. And lastly, I think I will actually take the opportunity to thank, to call on all the partners here to continue engaging in the implementation of the strategic plan, and at the same time make sure that whatever your contributions and achievements are actually captured in the national reporting system. Thank you, Nadia.
Thank you so much, Dr. Nima. Any question from the audience? Silence means that we agreed with everything the panelists said. Okay, we have a question. Ushers, please.
My name is Philippa Chibugu-Dikwe. I'm a breast cancer survivor for 27 years. I represent an organization I started in Rwanda called Breast Cancer Initiative East Africa. I am so excited to see everything that happened here, and I can't be any more prouder than I am today. But, I have a but. The cancers were pronounced. The researchers and the data that comes from Rwanda shows breast cancer as either number one or most commonly diagnosed. But in the resolutions, if you take the whole thing together, I have not, and I was noting down how many times breast cancer was put on the pivot. And by the way, next month, tomorrow, is Breast Cancer Awareness Month. I come from a country, US, where when breast cancer is mentioned, everybody gets up. And Rwanda is a smaller country. Since I've been here, less than 2 years, I have lost 7 women to advanced breast cancer because of lack of awareness. And I'm so excited that awareness, destigmatization, all that is being done. But I couldn't help it but to mention this. Cervical cancer is mentioned many times in a big way, and I know why. There's money supporting it. Madame representative from WHO. I would like to have a minute with you when we have time.
With pleasure.
I would like to know, as we start this 5-year plan, strategic plan, what is going to happen to breast cancer in Rwanda? What are we doing for breast cancer? Dr. Nima, you mentioned some money that is going to come to do whatever. There has to be a portion, a small portion, that's going to do the breast cancer awareness in Rwanda. We were here and somebody mentioned, I think it is the gentleman from insurance. People don't go for screening even when it's paid for. Mm-hmm. And some of the diseases that are not covered are non-communicable diseases. Mm-hmm. Please, I'm speaking because I have been in the situations that women in Rwanda have been in. In fact, I lost a sister because she was in Africa, and I always ask myself, would she be alive if she was in the US? My wish is for the Rwandan woman to have the same privileges that I had. Something needs to be done.
Sure.
Thank you.
Thank you so much, Madam. Thank you for sharing your personal experience and for bringing to our awareness that next month will be Breast Cancer Awareness Month, and hopefully Dr. Francois and the division are taking really good notes, and the WHO representative has already agreed to meet with you. Yes, there's a question with Professor Muchumbitsi.
Thank you very much. Mine is not a question. I would like to make a suggestion, because today is the World Heart Day, and cardiovascular diseases are the #1 killer over the world and in Rwanda. So you talked about screening at workplace, but I would like to suggest that you don't stop there. Mm-hmm. Could we train for resuscitation at workplace? Because when you have a heart attack, you don't have time to reach the hospital. And elsewhere, they have even defibrillators at the workplace. Mm-hmm. So could we, and the Rwanda NCD Alliance and Rwanda Heart Foundation are ready to support and help, could you organize training of basic life support at workplaces, where we should have the minimum requirement to take blood pressure, and one day maybe have also defibrillators. So don't only screen, but let us make sure we put in place a system to save lives. Thank you.
Thank you so much, Professor Muchumbitsi. Any further questions, suggestions?
Thank you. My name is Patrice Muitendam from World Bank. I would wish to thank the Minister of Health, RPC, and the DPs who worked hard to develop this plan. And it's really the first move to have this plan, as NCDs are becoming a challenge, a big challenge for us, Rwandans. And not only Rwandans, but also for all the people who are living in Rwanda. My concern is based on historic data regarding the share of NCD's budget compared to total health sector budget, which was less than 0.5%. For instance, in 2019-20, it was about 0.3%, and for the last year, it was 0.2%, and we understood that this was due to COVID-19, which was taking a lot of budget. But my question is, what are the partnerships RBC is building to mobilize additional resources? How the Ministry of Health will work with other government agencies, will work with other ministries, will convince the Ministry of Finance to allocate more resources to NCDs. Because when I look at the past budget and the budget requirements to implement this plan, I'm scared. Of course, I have hope that we can do something, as we have already started working with the Ministry of Health to mobilize resources for NCDs. I think so far, World Bank has already mobilized about $4 million to support the implementation of this plan. But still, we would wish to do more to mobilize additional resources. But my question is how RBC is going to build more partnerships, how it's going to convince those who are preparing the national budget to allocate additional resources to this plan. Thank you.
Thank you so much, Patrice. Regis, do you want to take that on, or we give it to DG RBC? All right. What did you point to?
So thank you so much. I think I'm happy that the question came from the World Bank,
yes.
where the money is coming from. So, but it's not just RBC or the Ministry of Health mobilizing these resources. This tool now is our tool, all of us here, and those who are following us online. Having worked in infectious disease and non-communicable diseases, I've seen that once you have a clear strategy, how much it costs and what are you going to spend for which activities, by when, the clear targets, it's the best start you can have. So for me, I'm not scared. I'm actually happy that now we have a basis. This is going to be our Bible, moving around, say, look, we have to achieve this. Mm-hmm. This is how much we need. So, of course, all these millions are probably not going to come at the same day in a basket with a check signed $300 million. But maybe even achieving step by step some of major activities, some of the top killers that we must stop before they take more lives, like the breast cancer issue that our colleague has just highlighted and emphasized, that we must start with these issues. Priorities that are within this book must be prioritized. So as we plan, there are things that we can do even without spending more money. Yes. Like Monique Deje from Inaloc has been highlighting, this is Siwo and Mihigo commitment from the communities. Do not require huge investment. It's just organizing and coordinating people around things that are saving lives, changing of behavior, lifestyle, eating well, the things probably cheaper and healthier than most expensive and risk factors for diseases. So I think from the World Bank, we are very happy to have you, and we will come with you so we mobilize more resources. Thank you.
Thank you so much, Deji. Any further questions? Yes, Dr. Kagliza.
Thank you. Deji notes remind me that I should say something. I think the strategic plan we are having today is going to inform some of our teachings and research. And he's right, it's not only about money, but I think putting hands together, I think we can do a lot of things and respond to the objectives of this strategic plan. And DG, I think we'll continue working together as usual. And I need to give a commitment here. We are going to work with you to implement some of the actions in the strategic plan, and during these discussions we have even come up with very, very good actions, and together we are going to achieve the objectives of this strategic plan. Thank you very much.
Thank you so much, Dr. Kagwiza, for the commitment. In the interest of time, I think we are going to stop here. If you have any burning questions left, the panelists are still with us. I just want to emphasize something that came over and over again. It's the strategic plan and, all the activities in it are like a non-sweetened cake for all of us to cut a piece and go with and, put our hands together in the basket and implement and have it achieved within the 5 years to come. I'd like to thank the panelists for your wisdom, for your shared experiences and your commitments as well. We look forward to a more synergized multi-sectoral committee to implement the strategic plan. And we hope that this is not the last time that all the 5 and all of us work together to actualize the plan. Thank you so much. And on that note, thank you. You can go back to your seats. You're welcome. And on that note, I'd like to welcome Dr. Albert for the votes of thanks. And from there, we will have Julien and the RHCC team take over on the media brief, and we'll call it a day from there. Thank you.
WHO representative, PSCs, Vice Mayor, DGRBC, ladies and gentlemen, all protocol observed, a very good morning or afternoon again. It is my immense pleasure to deliver the vote of thanks for this event to all of you and others we are having online, to this very important event in our fight against NCDs. I would like to thank our chief guest, Honorable Minister of Health, who spent some time with us. Because of his guidance, technical advice, and most of all, inspiration thoughts. I would like to thank the DG of RBC senior managers, NCD division team, partners, namely WHO, UNICEF, UNITA, the Defeat NCD Partnership, Rwanda NCD Alliance, Partners in Health, Bloomberg, WDF, Enabel, Chai, Health Builders, Reach, Care for Them, Breast Cancer Initiative East Africa, University of Rwanda, World Bank, ICRC, International Cancer Institute, Society for Family Health, Rwanda Non-Governmental Organizations Forum, and the media group. But also, I would like to thank all participants in this room, online, for making this event a grand success. Mine is very easy, just to say we thank you and look forward to keep this partnership and this working relationship in the implementation of this national strategy and cost reduction plan for the prevention and control of NCDs in Rwanda. We thank you and God bless you.
Thank you as well, Dr. Albert, for your leadership throughout this work. I've been told that there's a very interesting 3 slides that will show us. I guess everyone here got screened before they entered the room. Yes? So a representative of the volunteers that were testing people outside would like to show us the results from your screening, and from there, I think she'll have a few words to start mobilizing us and showing us the importance of early screening, even though you are asymptomatic or symptomatic. Go ahead.
Thank you very much. We are going to present the results from screening. We are going to present the results from screening. It's a short presentation, and we have emphasized on blood pressure as long as we are in World Heart Day. Also, other results are available, but we are going to present about blood pressure results. Next slide, please. As you have seen, among all participants who have been screened, we have found that 74.1% have normal blood pressure, and 21.9% have hypertension, and 4% have hypotension. Among those 21.5% who have hypertension, only 3% were aware that they have high blood pressure. The classification of blood pressure was based on the WHO standard as it is described there. Next. This is like starting implementing the strategic plan, and you have to know your number, because you can't prevent something you don't know. When people know their number, they can keep themselves healthy, and when they get in a hypertension, they can go for the treatment. It's just knowing your number. And as we are moving to 25% reduction of premature death from NCDs by 2025, this is one of the steps for people knowing their numbers ahead of time as early detected. And also it will help us to reach on 1/3 reduction of premature death from NCDs as targeted in SDG 2030 in target 3.4. Thank you very much.
Thank you so much, Viviane and your team, for first having screened us and for giving us our numbers, a summary of the numbers that you found. Thank you so much. I think Andre and his team, over to you for the group picture. I'm told that there's a bit of protocol. DG, RBC, and his table will line up front. There's PS, Ministry of Sport, and PS, Minijust, Ministry of Justice, will join the table with DG, Professor Muchumbitsi, Dr. Dungu, and Dr. Kagwiza, and then the rest of us will follow suit. I hope it's just going to be a 5-minute maximum session. If we stretch coming forward, we will even use 3 minutes. And it's on this note that I would like to thank you all for your participation, for your attention, and looking forward to working with you and having a successful event after we had achieved a 25% reduction in premature death. Yes, I will repeat that. The table with DG, and colleagues will come up front. We'll be joined by PS Ministry of Sport and Minijust, and then the rest of us will try and align after them. Yes, with social distance.